Hello, my name is Arnav Aggarwal. I'm a senior here at the University of Illinois, and I'm majoring in math statistics with a minor in computer science.
Hello, my name is Sangjun Ko. I am a senior majoring in statistics, minoring in data science and math. And we're here today to present our winning paper in the 2024 CIC Student Paper Challenge. Our paper is called Identifying and Addressing the Socioeconomic and Mental Health Impacts of COVID-19 in Mexico. Now I'll pass it on to Arnav to talk about the introduction.
So we'll get started off with some context. The COVID-19 pandemic has disrupted societies worldwide and worsened existing inequalities, especially in Mexico, where societal and economic weaknesses are pronounced. Young adults, women, and low-income households were hit hardest, facing increased mental health issues, job losses, and income cuts. The pandemic exposed these societal gaps, underscoring the need to address them for future resilience. For the objective of our study, we use data from the COVID-19 survey. This study examines the pandemic's socioeconomic and mental health impacts on Mexican households. The goal is to pinpoint which groups are the most affected and to guide strategies for minimizing similar impacts in future crises. For the focus, the analysis centers on three key areas: job loss, income reduction, and mental health. By exploring these issues across different demographics, such as age, gender, and region, our aim is to provide policymakers with targeted, data-backed recommendations for supporting the most vulnerable as Mexico rebuilds. And now I'll pass it off to Sam to tell you more about the data.
Sorry. Yes, thanks, Arnav. So for our paper, we used data from the nCoV-19 dataset, which was a compilation of a bunch of phone interviews that this university conducted. And in this dataset, we're gonna focus on four key areas: employment, income, mental health, and education. And to give you a little bit of a background on the data was collected through phone interviews, as I said, and it covered 32 Mexican states with a sample size of over 1,400 respondents. And overall, this data provides good insights into the demographic variables, the economic impact, health and well-being, and education. And we can use this to identify vulnerable groups and, as Arnav said, propose interventions. Uh, Now looking into the methodology that we used over in our data processes. In the first step, we cleaned the data and prepared it for further transformation. And in this stage, we were looking at variables that had missing values or like a irregular pattern. And there were a lot of variables with over 50% missing values. And these variables were excluded from the data to maintain integrity. And usually variables with a lot of missing values don't really provide any meaningful information or information that we could use. So those variables were removed, and for variables that had between 10 to 50% missing values, we used this method called K nearest neighbors. And then for those that had less than 10% missing values, we just filled them with the median. And in the data transformation step, which is the next step, this step included converting categorical variables like socioeconomic level and states um, into categories and segmenting respondents by age group to analyze any disparities. And following this, we did geospatial integration. And we did this by integrating state-level shapefiles, which we found on government websites in Mexico from Mexico, where they included like the specific locations, coordinates of each state, so that we could map this in Python, which we used. And we did this by merging the COVID-19 dataset, which included where the respondents lived. And we just merged those two data sets and we basically plotted this in a map that I'll show later. And in the last step, statistical analysis and visualization, it consisted mostly of descriptive analytics and visualizations, including heat maps and charts. And we used this to highlight how the pandemic affected people in various domains. So looking at the graphs and charts, on the left, we see a box plot showing the anxiety levels by gender. And our analysis shows that females reported higher anxiety levels than males, with women being disproportionately affected by the pandemic in terms of both mental health and employment. And to the right, we see a heat map of regional employment loss. So as we can see in the heat map, The darker areas show where the impact was the hardest. And we see that how central and southern regions like Mexico City and Veracruz experience higher job loss. And this might be because of their economic reliance on sectors such as tourism and services. And since COVID, the lockdown, and social distancing, not a lot of people were able to visit these touristic areas. So this regional vulnerability highlights the need for targeted economic support. Now, looking at these charts on the left, we see job loss by age group, and we found that individuals between 18 and 45 years were the most affected. So starting with the younger working population, especially those aged 26 to 35, they faced the highest job losses, which directly affected their financial stability and mental health. And in the second chart, we see income reduction by socioeconomic level. And the socioeconomic level goes from 1 to 7, 1 being like high socioeconomic level and 7 being a low socioeconomic level. And as expected, we don't see a really clear pattern, but those in the higher socioeconomic level do not seem to be that affected by um, income reduction. But as we see in the lower socioeconomic levels, it does have a meaningful impact of income reduction. Now, given all of this analysis and descriptive analytics, I'll pass it on to Arnav to talk about the conclusions.
So, in closing, our research highlights the significant disparities in how different groups in Mexico were impacted by COVID-19. Young adults, women, and lower income households bore the heaviest burdens, facing higher anxiety levels, job losses, and income cuts. Central and southern Mexico, particularly dependent on vulnerable sectors like tourism services, were especially hard hit, worsening pre-existing inequalities and complacing a recovery. Our findings underscore the need for targeted interventions. Expanding mental health services is essential, as younger adults and women were most affected by anxiety and depression, yet support remains limited. Improving these services will aid immediate recovery and build resilience for future crises. Economic support is also equally crucial. Job and income losses have left many financially unstable. Providing financial aid, job retraining, and employment support, especially in areas like Mexico City and Veracruz, can help stabilize these communities, ensuring that not only recovery, but long-term economic resilience. These interventions are key to helping vulnerable populations recover stronger and be more prepared for future challenges. Now, looking at how we can build upon this data, looking ahead, several areas need further research. First, it's essential to study the long-term mental health effects of COVID-19 in Mexico. Our findings highlight short-term increases in anxiety and depression, but tracking how these changes persist or change over time, especially among young adults and women, will help in creating targeted mental health support systems. Also, another area to explore is the impact of education disruptions. Prolonged school closures in many Mexican regions likely have lasting effects on employment and income. Examining how these closures affect young people's career prospects and economic mobility will be key for shaping future education policies and recovery effects. Finally, expanding this research across Latin America is extremely crucial. While we focus on Mexico, the pandemic's socioeconomic impact varied regionally due to differences in healthcare and policy responses. Comparing these responses can provide valuable insights into effective strategy, helping policymakers in Mexico and neighboring countries as well better prepare for future global crises.
Thank you, Arnav. Now, these are our sources and our acknowledgements, and that's our presentation. Thank you so much for listening and your time.
Our contact information is there if you need. And yeah, thank you so much for listening. We had a pleasure presenting.
If there are any questions, let us know, and reach out if you want to. Thank you.
Thank you.